You know, it is, I don't know how many of you have mentors. How many of you have mentors or role models? I've never been in the position to where I have both of my role models in the same room with me. Dr. Clark has guided my practice regarding civility, and Dr. Brodie guides my practice regarding compassion. So it is my pleasure and my honor to introduce to you Dr. Lori Brodie. She is the Director of Compassionate Care Integration and also an assistant professor at Galen College of Nursing. I really encourage you to read her bio. It is a very interesting and comprehensive bio. Lori is tasked to roll out compassionate integration across 22 campuses across the United States. So she has a big job, she has big shoulders, she handles it well, and we love it to death. Please help me welcome Dr. Lori Brodie.
Thank you. You're so sweet. Thank you, friend. Hi, everyone. Good morning. Good morning. How's everybody doing? If you need to stand up, if you do when I'm talking, I'm not offended. If you need to walk out, not offended. Just I know when we're sitting a lot. Dr. Clark, amazing presentation. When I saw the agenda and they said, oh, you're going to go after Dr. Clark, I'm like, okay, no pressure, but I'm honored. And really, my content is kind of the yes and to Dr. Clark's content. So if anybody can't hear me, let me know. I'm pretty loud without this, so I know I fade in and out. So just give me a shout. Thank you to everybody who's here and done all this hard work to get us here today. I know it's a lot, and thank you to those of you who are here. I'm going to ask that you are mindful here instead of your mind is full with all the other things, like your grocery list and your stuff you're missing at work right now, and just be present if you can for the next 30 minutes. I think this is the clicker. Yes? Okay. I want you all to just think about what the word compassion means to you. Just think about it while I proceed through a couple of slides. If I know which one to... It's the green one. Yay! Okay, I started off well. You know who I am. Just a quick background. I have a long background, so we're not going to go through that, or that would take the whole half an hour. But I came to nursing a little late in life. It was really my third career. I have a PhD in psychology and a DNP. I needed to know all of the things. So Dr. Clark and I have a lot in common. This is what we're going to do today. Those of you who are educators need objectives. Here they are. We'll move along. Anybody here been a patient last year, 2 years? Anybody here work with patients this year? Anybody ever have an experience where you didn't feel like your nurse cared about you? Oh, let me put 2 hands up. Really the reason I became a nurse? Really, y'all. If I'd known I was going to be a nurse, if you said to me at 25, you're going to be a nurse, I was like, no, not me. It was because I had nurses who didn't care about me and didn't care about my family. And I was taking care of my dad one day after he'd had bladder surgery, and this home health nurse came, and I was changing his wound vac and his catheter bag, and she's like, how long have you been a nurse? I'm like, I'm not a nurse. She's like, ma'am, and first she called me ma'am, didn't love that. Ma'am, if you can do this for your father, this is what you should be doing for a living. I was like, okay. So I went and became a nurse. And there's a lot more to it than that, but it was really because I realized there was an opportunity. So I knew then that I was going to work in compassion without knowing I was going to work in compassion. But our CEO, where I work at Galen College of Nursing, said, every patient deserves to have a caring nurse. We don't teach that. It's not in the NCLEX. There's not a question about, do you care about people? There are questions about cultural humility and therapeutic responses, but do you have compassion? Y'all, I didn't know that people became nurses for other reasons than to take care of people. I was so young, right? Naive. I didn't know that. We know it now. We know it now. But we can teach it. And this is not because of the pandemic that we've started this, and this is busy on purpose to show you that this is a problem that has been going on for decades. The trends in nursing to lack compassion and care keep going. It just got highlighted by the pandemic. So we've identified this opportunity. Let's teach people when they're in nursing school about the importance of compassion and bring it to the field that way. So my hope, who's in practice here, in clinical practice? And who are educators? My hope is those of you in education do this, and those of you in practice see this and can do this where you are as well. Because it's easy. This is like all complicated, what we did to build our model, right? We used all the theories and all the things, but it's not hard. We just, to our value statements, our ICU 10 was a little different at an academic institution. We just said, I care, and I care compassionately. And those are our values, and that's what we live by, and that's what we try to do. All of the things, not perfect. Some days I'm not good at compassion. No one is, right? Every day, all the time, but my intents are good. And that's what really matters. But the big picture of what we're trying to do is change the nursing workforce. No small task, right? I'll do that after lunch. My CEO will say, how's it going? I'm like, I don't know. Have you been a patient? Are they nicer? Tell me. I don't know. It's hard to measure, right? I want to write all these research articles, and I sit down to do them, and it's like, well, where's your data? I'm like, qualitative at its finest, because it's very hard to measure, even with the tools. But we want to increase the ability for people to have self-compassion so they stay in the field, don't burn out, compassion with each other so we don't have so much incivility in nursing. Sorry, Cindy, I want you to still have a job, but I'd like to get rid of that. And improve our patient outcomes. We know patients are going to get better when they feel cared about. It's science. We know this from all the research, right? But why don't we all do it? We do. All of us in here probably do. But why is the nursing profession as a whole, why is this a problem? We decided at Galen that in order to do this, it needed to be not just what we were teaching the students. It needed to be our culture. I started with executive leaders. I'm going to be honest with you guys. Those are the people that need this the most, right? I know everybody's like, yes, girl, preach it. Yeah, they do, because they're so busy and they're so important. Maybe sometimes self-perceived importance, but that's a different presentation. My dad wanted me to do stand-up, and I never did, so this is as close as I get. So I appreciate the laughter. It really does keep me going. I'm all about humor and engagement. But in seriousness, I said, this has to be everybody. Financial aid needs to take compassionate care training. Oh. And they do. I just did a session yesterday. That's why I wasn't here. With our financial services leaders. And you know what? They loved it. They said, this is what we needed. We didn't know how to handle de-escalation, how to talk to students who were rude to us. They didn't know. They were afraid. They didn't want to lose their jobs. So we assume that even in clinical practice that our new nurses know how to be compassionate. Anybody remember their first day as a nurse? I do. Ooh. Yeah, and I was older, so everybody thought I knew everything because I was older, right? They're like, oh, she'll know. I'm like, I don't know. Foam hands, check. Do this, check, right? Oh, how are you today? Ooh. It's not the first thing that comes to our minds, but we can make that an automatic behavior as automatic as foam hands. I turn my students around sometimes and said, how is your patient today? Well, Mr. Smith is such and such on this medication. I'm like, no. How is your patient today? Are they happy? Are they sad? Are they scared? Huh? Like, yeah, that's not okay. What color is their hair? Did you look at your patient? Brown? I'm like, go back. Ask Mr. Smith how he's doing as a human being. Not what his pain level is. How are you? Remember when we all thought that we would be that nurse that did that, and then we had to chart, and we had 12 patients by ourselves and all the things, and then that's what gets lost. I'm skipping this on purpose. But we have to identify those behaviors, because we can all just say, go be compassionate. Got it. But we might not know what that looks like. My financial services friends yesterday didn't know what that looked like. Wherever you're in practice and whatever you're doing, you can easily identify what those behaviors are for people and give them statements. Let them tell you and work with them. I demonstrate compassion by listening, by being present. I might not always say the right things. I know for sure, 1,000%, I do not say the right things. And I'm considered an expert, allegedly, in therapeutic communication, but my husband will tell you I don't do that all the time. I try. So what does the word compassion mean to you? Anybody? Just throw them out. Recognizing humanity and in someone else. Recognizing humanity in someone else. I love that answer. Thank you. Anybody else? Yes, recognizing there's others besides yourself. You're not the only person. Person walking down the road with your phone, put it down and realize you're not the only person, right? We all see these people. Recognizing we have differences and that should be celebrated and not criticized. Recognizing that everybody's going through something. Right? Anybody here not going through something right now? Because if you're not, can we meet outside after? Give me the name of your provider. So if we have that recognition and our goal is to make people feel like they matter, that doesn't sound hard. So someone said, I met this woman on the plane literally yesterday who used to be a hospital administrator, and I really liked her because she didn't talk to me till we landed. But we all know that when we get on a plane, right? It was like, let's just for a second. It was a very bumpy, uncomfortable ride. And she started telling me that she used to be a hospital administrator. I'm like, oh, interesting. And I told her what I did. And she went, huh, really? Do you work at a hospital? I said, no, I work in a nursing college. She goes, you need to go work in the hospital. Why? I said, why? She said, you can't teach compassion to people. I said, oh, respectfully, ma'am, I disagree. You can. There are people who are inherently born with compassion, 100%. Just like there are people who are inherently born that can put IKEA furniture together. I am not that person. I am not the person. I'm a compassion person, not the IKEA person. But you could teach me. I could learn. It's not going to be something you want to sit in, let's face it. But I could still learn the mechanics. It's not impossible. And so that's been an excuse we've been using for entirely too long. They weren't born that way. Fake news, y'all, fake news. We can teach it, and the number one way we can do that is just what Dr. Clark said earlier, model the behavior. So the best way to model it is to do it for ourselves first. If I'm telling my team, my imaginary team, I'm a department of one, but if I'm telling my team, don't email after hours. I had this conversation with our senior leaders. Don't put your employees through that, making them think they're supposed to respond. Don't work on the unit 7 days a week, 14 hours a day, and make people think that's what leadership is. Don't do that. Because you're telling people that you don't care about yourself, or if you want to move up in the world, you have to sacrifice everything in your life. Being busy is not a badge of honor, to the point if it's compromising your self-care. So we have to take care of ourselves. That self-awareness that Dr. Clark mentioned is so important. The more self-aware we are, the better. I love when people record me and then I watch myself. I'm like, ooh, I didn't know I'd do that. Has anyone ever done that? Yeah, right? But it helps us with our self-awareness. Or my colleague, Dr. Hedges, I can say, how did I do? And she'd say, you know, Lori, you have this habit of whatever. Talking with your hands entirely too much. I can't change that. But I would be more aware of it if she said to me, that's too distracting. That's compassion to tell somebody, but it's also compassion to care enough about how we're perceived, our professional appearance. It all links to our compassion. So these are actual things we can do to be compassionate. I'm already like 10 minutes till I'm done. Wow. So the most important one on here is seek to understand. We all hear that. 8 ADHD folks in my presence, it's hard. We're talking, we're like, ooh, I want to answer. Can't wait to answer. But we have to listen. We have to listen to understand and not already be formulating our response. That can be so hard. But if I'm genuinely asking you, please tell me what's wrong. And then you start telling me and I'm like, ooh, it's not compassion, because you've got to be present. You have to be authentic and really want to seek to understand. Anybody here live with somebody else in their house besides just yourself? Oh, okay, most of you. Anybody here live by yourself and think that there's someone else living in your house with you? I'll meet you outside. I am a psychiatric mental health nurse practitioner on the side. I still do that, so I'll help you out. Do you ever hear, well, I'm sorry if what I said offended you, right? I'm sorry if what I said made you mad. That's not an apology, you guys. That's like, what's wrong with you, right? Anybody have a relationship with a significant other and they tell you everything's fine? I'm fine. Your new nurses, if you check in with them and they say everything is fine, it is the same thing. They are not fine. They are, I'm going to tell you too, your middle level nurses, your latent career nurses, anybody, if their answer is fine, we need to ask more questions. Tell me what you mean by fine. What makes it fine? And we need to not do the whole, it's your fault that you feel this way. If there's a problem with how someone feels, we need to find out what it is. Now, I will admit I have a very low, I don't want to say tolerance, threshold for people who use things like psychological safety as an excuse when there's really no psychological safety problem. And I'm seeing a lot of nods, like, yeah, too much TikTok, gonna use the buzzwords, this is gonna help me get out of having to do this today. Anybody ever have a person like that? Oh, okay, a couple people like, yeah. But we still need to find out why they're doing that. Instead of saying, oh my gosh, here we go again with this one who's complaining again about this person who doesn't like them. Why are they doing that? How can we help them? That is compassion. And sometimes people need to move along and find their joy somewhere else. That's okay. Coach up, coach out. But that's compassion. To let somebody continue to fail, be judged, is the absence of compassion, and we have to hold people accountable. People say to me, your job is just to get everybody to be nice. No, it is not. That's a start. But my job is also to get people to learn how to hold people accountable with kindness. We don't have to be mean. Sometimes we can be firm, but we also have to be kind and ask those hard questions. We all know everything I'm saying today, nothing's rocket science. It's just a reminder, right? But this all starts with emotional intelligence. If we have increased emotional intelligence, we know this from all the research studies, which there's a gazillion. I just put one on there. There's so many. Our stress levels go down. Our job satisfaction goes up because we're not stressed. We're not standing at the Pyxis for 20 minutes, right? But we have to have increased emotional intelligence to do that. Do you guys think we can teach ourselves, make our emotional intelligence higher? Yeah. It's another thing. People used to say, well, you're either born with it or no, fake news. You can work on that too. Recognizing that people's responses are influenced by so many things. Who slept here last night in the hotel? Anybody hear the music at 2 a.m.? Was it just me? Oh my word. I was like, what is happening? But I was able to go back to sleep. But if I hadn't been, and I'm up here today, and I'm not as energetic, well, let's face it, that doesn't happen. But what if I was stumbling more with my words? You guys would be like, oh, this lady doesn't know what she's talking about. It's just because I didn't sleep well. But we have to give each other that grace. Anybody get mad at work when their colleague comes in and they're like visibly upset? It's like, you got to leave that in the car, right? But we don't have those conversations. We just think it in our head. It's not really compassionate. Have those conversations. I don't know if you realize this, but here's how you're presenting today. How can I help you? What can I do to take some of your burden away? Do you need a hand? Do you need a minute? Do you need a hug? That's compassion. Skipping on purpose. Okay, I love this question. How long on average do you think it takes to form a connection with somebody you just met? 30 seconds? 1 second? Oh, I like that. How long? Immediate? Any other answers? Depends on how, ooh, I like you. Depends on how present you are. Anybody else? There's a There's actually science about it. Of course, there's a study, right? 56 seconds. This is Christina Dempsey's work on compassion. On average, it takes 56 seconds to form a connection with somebody you just met. I made a connection this morning with, I'm sorry, I don't remember your name, but you're left-handed. Yeah, we made a connection. I don't even think it was 56 seconds, but probably close. But the thing is, when we're making those connections, whether it's with our patients or our colleagues or our employees or the people we work for, it has to be authentic. It can't just be like, love what you're doing on this and you don't mean it, because that's not compassion. Anybody ever feel like, oh my gosh, I want to help, I want to say something, but I have no idea what I'm supposed to say right now? Just me? Yeah. Anybody ever say something and realize, oh yeah, that was wrong. Not the right thing to say? Yeah, every day. Ask my husband. I do it all the time. Nobody says all the right things all the time. Even if you are an alleged expert in therapeutic communication, no one. It's your intent that matters. If you're normally saying the right things and one day you slip and say something wrong, then no one's going to think about it. But if you're constantly criticizing, what's wrong with you? Why don't you seem like you liked the presentation? It was great. What are you talking about? That's not going to be very therapeutic. But don't put ourselves in that perfectionism cycle where we won't say something because we're afraid we're going to say the wrong thing. The worst thing we can do when we have a situation where someone is talking to us or needs help or we see someone struggling, we see a new nurse who is having a hard time and we don't know what to say, the worst thing we can do is say nothing. Right? Anybody here ever get bullied as a nurse? Yeah. I usually say raise your hand if you didn't, because that's 2 or 3 people. We all have. And sadly, for my friend in the front row who shared her story, and kudos to you for making that difference, a lot of us didn't speak up. I did. I know everybody's surprised, but I did. But we can say things like, it sounds like you're struggling. You seem like you're having a hard day today, instead of what's wrong with you. Instead of, I know how you feel because it happened to me. We don't know how anybody feels. We've all heard this, but yet in practice, it can be hard, right? This is like our reminder day. Everything happens for a reason. And my favorite, the competition statement. Well, at least you didn't have to sit through compassionate care training, okay? Think you had a bad morning? Whole half hour. Mm-hmm. It makes it a competition. It's not a competition. Well, at least you didn't have this person be mean to you, or at least you got to have lunch today, right, on the unit. I can remember putting food in my mouth and then going to the bathroom while I'm chewing, because that was it. It was that or no food or no bathroom. That wasn't a badge of honor. That was an emergent situation, and we shouldn't be comparing like how hard we've had it to how hard someone's having it. When you're in practice, whether you're in practice or whether you're in education or whatever you're doing, 1 minute matters. Making that connection. Asking people, hey, what would you like me to call you? Tell me about your culture. You do what on Saturdays? I want to learn about that. So, I'd love to hear from 2 or 3 of you. Wait, am I up? I'm good. Oh, I've got this timer. That's right. Okay, I got 2 more minutes. Yes. Tell me your name, please. Jennifer.
I have a question, actually, kind of about what you think would be a good way of doing this. So, my background is ICU, and during COVID, like I had started a couple years prior to COVID, and during COVID, I'm a deeply compassionate person naturally, so no one needed to train me on that. I was just, that was who I was. During COVID, the severity of the burnout in ICU made it where I didn't
Oh, thank you. Is once you stop being able to feel anything or care for your patients, that's when it's time to go. And that's usually been my recommendation, because I don't know how to teach you how to feel again, because typically it is trauma.
Yeah.
And so that's usually my recommendation to people once they, so my question is kind of, do you have a different recommendation for experienced nurses who have gone through the gamut and then a trauma response starts to develop and they can no longer really express that care? I feel like for a lot of us in the room, probably stepping away from bedside was the way to tap back into that feeling and that emotion. And so I didn't know if you had any other recommendation.
Great question, and thank you for sharing and for recognizing that you needed help, because a lot of people won't recognize it. So teaching people how to recognize it early, before they get to the point that they don't care about patients, would be my suggestion, which we can do through self-care, debriefing, checking in, support groups. As silly as this sounds, a lot of nurses think they're the only ones who are going through what they're going through, right? And we go back to basic psychology, that sense of universality, and we know, like, oh, there's other people who feel this way. That in and of itself can be so helpful. So I would say make a support group if you can. Teach nurses about those early warning signs. All not dreading coming to work, feeling like you're an imposter, starting to get dismissive of your patients. When we first start feeling like that, take pause. Sometimes you could just take a few days off and implement a self-care routine that you can do daily, which I don't mean like 4-hour massages, even though that sounds amazing, but something realistic we can do daily, even if it's 5 minutes in your car by yourself with your eyes closed before you go from work to life. And just having that time, journaling, whatever it is. It's different for everyone, right? But if we put that as part of our daily life, that can prevent that from happening. So I think to reframe that as, let's start taking care of ourselves. And in reality, that should be in our orientation. That should be in our mentoring programs, is not just telling them, oh, practice self-care. Because if I got one more email about a massage during COVID, I was about to lose my mind, right? That's not going to help. Give me the tools to do something for myself every day that will keep me from burning out. And that would be my suggestion. Good question. I think I'm getting the red light. So, any other questions before I wrap up? I'll make sure you can get these slides.
Any other question?
Thank you guys for your time today. I enjoyed working with you.